Welcome to Module 9. In this video, you will learn about Migrants' Wellbeing. This is a hybrid learning curriculum for migrants. Let's get started. Introduction. This module explores the holistic concept of well-being, effective communication strategies, stress management techniques, resilience building, and self-care practices. Participants will gain insights into assessing well-being, mastering communication skills, managing stress, cultivating resilience, and prioritizing self-care. Through interactive activities and practical strategies, participants will enhance their ability to navigate challenges, communicate effectively, and prioritize their physical and mental health. Together with some theoretical contents, practical tools, tips, and self-assessment activities will be found. Learning outcomes. By the end of the module, participants will gain knowledge level, defining well-being as encompassing physical, mental, social, and emotional health, understanding the concept of subjective and objective measures in assessing well-being, gaining insights into the factors influencing migrants' well-being, skills level, developing effective communication strategies, enhancing online communication skills, acquiring skills to overcome language barriers in healthcare. Attitude learning objectives, recognizing the importance of resilience in handling challenging situations, embracing self-care practices, developing a positive attitude and understanding the importance of self-care for well-being. Understanding well-being. Introduction to the concept of well-being. Well-being is a broad concept that covers all aspects of a person's life, including their physical, mental, emotional, and social health. It's about feeling comfortable, healthy, and happy, both individually and within society. Achieving well-being isn't just about avoiding illness or distress. It's also about having positive experiences like satisfaction, happiness, resilience, and a sense of purpose. Measuring well-being. Measuring well-being can be challenging due to its subjective nature and multifaceted components. However, researchers and practitioners have developed several methods to assess different aspects of well-being. Here are some common approaches. Subjective well-being, SWB. It looks at how people personally rate their own well-being. This involves asking about their happiness, satisfaction with life, and how they feel overall. Surveys, questionnaires, and interviews are often used to collect this kind of information. Objective indicators. These are measurable factors of well-being that can be observed from the outside. These include things like income, job status, education level, health measures like BMI and blood pressure, access to health care, and environmental conditions. While these indicators give a clear picture of well-being, they might not reflect how individuals personally feel. Psychological well-being. Psychological well-being looks at how people think and feel, including things like self-esteem, independence, life goals, personal development, and healthy relationships. Tests and scales, like the Psychological Well-Being Scale, PWB, and the RIF Psychological Well-Being Scale, are often used to measure this aspect of well-being. Social well-being. Social well-being is about how well people connect with others in their communities. This includes having good relationships, feeling like you belong, and being involved in your community. Indicators of social well-being might include things like how connected people feel, how much support they have from others, and whether they feel lonely. Overall well-being index. Some experts use combined measures or scales that bring together different factors from various areas to give a complete picture of overall well-being. These scales might give more importance to certain aspects and then put all the information together to give one overall score or ranking. The Organization for Economic Cooperation and Development, OECD, Wellbeing Framework. The OECD. Wellbeing Framework guides the OECD's work on monitoring trends in current well-being outcomes, inclusion, and the sustainability of well-being across member and partner countries. The framework includes 11 dimensions of current well-being, covering outcomes at the individual, household, or community level, focusing on material conditions, quality of life factors, and community relations. Because well-being averages mask inequalities within countries, the framework measures the full distribution of well-being outcomes by taking into account gaps between population groups, gaps between those at the top and bottom, and deprivations. The framework also includes the resources that underpin future well-being, measured through 4 types of capital: economic capital, natural capital, human capital, and social capital. The capitals emphasize the sustainability of well-being into the future, and each of the capital stocks can be affected by decisions made or not made today. Migrants' well-being. In analyzing migrants' well-being, there are various factors to be taken into consideration. Resources that migrants bring with them: education, skills, health status, social connections, economic resources. Circumstances encountered in the host country: supportive context or not, access to good jobs, good housing, healthy environment, effective governance. Duration of stay in the new country, level of integration, mastering the host country language, familiarity with the governance. Measuring well-being is crucial for assessing the quality of life and navigating the challenges of adapting to new environments. Being able to evaluate one's own well-being facilitates clearer communication of personal needs to healthcare institutions. Moreover, assessing well-being reveals disparities in healthcare access and outcomes within migrant communities, empowering them to advocate for their rights and equitable access to healthcare services. Now let's test your knowledge with a quick assessment. Answer the following questions to see how much you've learned. Indicate whether these statements are true or false. 1. Well-being is solely about avoiding illness or distress. True or false? 2. Subjective well-being, SWB, involves assessing how individuals personally rate their own well-being. True or false? 3. Perception-based data may produce unexpected results due to differences in expectations between migrants and native-born populations. True or false? 4. Migrant well-being analysis does not consider the circumstances encountered in the host country. True or false? Now let's test your knowledge with a quick assessment. Answer the following questions to see how much you've learned. Match each factor or concept with its corresponding description. Factors or concepts. 1. Subjective well-being, SWB. 2. Psychological well-being, RE, social well-being. OECD Well-Being Framework. Descriptions. A. Focuses on aspects of life self-esteem, life goals, and healthy relationships. B. Measures how people personally rate their own well-being, including happiness and life satisfaction. C. Guides the OECD's work on monitoring trends in current well-being outcomes, inclusion and sustainability across member and partner countries. D. Pertains to how well individuals connect with others and their communities. Let's review the correct answers to the assessment. True or false? Question 1. The correct answer is false. Question 2. The correct answer is true. Question 3. The correct answer is true. Question 4. The correct answer is false. Match the factors. Question 1. The correct answer is B. Question 2. The correct answer is A. Question 3. The correct answer is D. Question 4. The correct answer is C. We hope you got all the answers correct. Communication skills for well-being. Effective communication strategies. Being a good communicator means having the skills to share information clearly, kindly, and understandingly. What is effective communication? Effective communication is the process of exchanging ideas, thoughts, feelings, knowledge, and information in a way that makes the message clear and meaningful. When we communicate effectively, both the person talking and the person listening feel happy with the conversation. Why is it important to be an effective communicator? Being an effective communicator is extremely important to understand health information, medical instructions, treatment options, preventive measures, to express your needs or concerns, to build trust with the healthcare providers, and to navigate the healthcare system better. Tips for communication improvement. 1. Keep your audience in mind. Your audience will naturally be more interested and engaged when you tailor your communications to their interests. 2. Keep it simple. Even the most engaged and committed audience will eventually get bored. Keeping your message simple and concise will make it easier to understand and retain. 3. Consider the best method to deliver your message. If the information you're conveying isn't urgent, consider sending an email or a memo. This is especially important when communicating expectations. Written communication will give your audience more time to review it, think it over, and follow up with questions. 4. Get them involved. There are few better ways to learn new information than to teach it. Ask your audience for their input feedback. Not sure they got it? Ask. A powerful technique is to ask people to repeat back their version of what you just said, or to take a role in explaining new concepts. 5. Favor face-to-face conversations when possible. Communicating face-to-face adds multiple layers of information to an exchange. 6. Ask for feedback. Not sure they got it? Ask. A powerful technique is to ask people to repeat back their version of what you just said. 7. Read nonverbal cues. There are various types of nonverbal cues. Yawns, fidgeting, and looking around the room are usually clear signs that your audience is thinking about something other than what you're trying to convey. If you notice this, don't take it personally. Try asking them to share what's on their mind, recap previous points they may have missed, or adjourn for a later time. 8. Minimize distractions. Keep distractions at bay by leaving unnecessary electronic devices out of the space. Keep the attendance limited to just those who need to be there, and avoid scheduling at a time when people are likely to focus on something else. Online communication improvement. Online communication is rapidly making its way into everyday interactions of all kinds. Since it presents a unique way to interact, here are some things to keep in mind. 1. Stick a time limit. Keep the meeting short and to the point, and be especially vigilant about minimizing, potentially, marathon Q&A sessions. 2. Recap important details. A lot of nonverbal and interpersonal cues can be lost over a digital connection. Ensure understanding by recapping the key points. 3. Don't forget to respond. Be sure to respond to each communication with a quick acknowledgement, event if it's an informal one. Although you may have received the message, it's likely that the person on the other end will have no way of knowing unless you let them know. 3 extra tips to sharpen your communication skills. Be approachable. If your audience feel intimidated or worried that you may not respond well, they're less likely to come to you with information. Be patient. Not everyone communicates the same way. Taking the time to be sure you've understood the other person and communicated clearly can pay dividends. Be self-aware. It's okay if you're still developing your communication skills, nervous, or having a bad day. It takes time and practice to become a skilled communicator. Overcoming language barriers. Different languages can cause more stress and mistakes in communication for patients who are already anxious. This is less likely to happen when patients speak the same language as their healthcare providers. When doctors talk to patients about their diagnosis or treatment, it's important to explain the risks clearly. If the risks aren't explained well, patients might not follow instructions or choose not to get treatment that could save their lives. Here are 5 strategies to overcome the language barriers in healthcare. 1. Use language assistance services. Healthcare facilities often provide language assistance services such as interpreters, translators, or multilingual staff. Don't hesitate to request these services if you're having trouble understanding or expressing yourself in the language spoken by your healthcare provider. 2. Utilize technology. Technology can be a valuable tool for overcoming language barriers. Apps and devices are available that offer translation services in real time. 3. Prepare in advance. Before your healthcare appointment, write down any questions or concerns you have in your native language. Translate these notes into the language spoken by your healthcare provider, or use a translation app to ensure clear communication during your appointment. 4. Use visual aids. Visual aids such as diagrams, pictures, or videos can help convey important information when language barriers exist. Ask your healthcare provider to use visual aids to explain medical conditions, treatment options, or medication instructions. 5. Clarify and confirm. Don't hesitate to ask questions if you're unsure about something your healthcare provider has said. Repeat back the information in your own words to confirm understanding, and ask for clarification if needed. Now, let's test your knowledge with a quick assessment. Answer the following questions to see how much you've learned. Indicate whether these statements are true or false. 1. Effective communication is only about conveying information, not about making the message clear and meaningful. True or false? 2. Online communication should not be kept short and to the point. True or false? 3. It's unnecessary to respond to each communication during online interactions. True or false? 4. Being approachable and patient are not important aspects of effective communication. True or false? 5. Different languages can cause more stress and mistakes in communication for patients who are already anxious. True or false? 6. Language assistance services are not available in healthcare facilities to overcome language barriers. True or false? Let's review the correct answers to the assessment. 1. The correct answer is false. 2. The correct answer is false. 3. The correct answer is false. 4. The correct answer is false. 5. The correct answer is true. 6. The correct answer is false. We hope you got all the answers correct. Stress management for well-being. Understanding stress and its impact on well-being. Stress is the body's natural response to challenging situations. In moderation, it can be beneficial, motivating us to perform at our best. However, when stress becomes chronic or overwhelming, it can have a profound negative impact on our overall well-being. Here are some ways stress can affect us. Physical health. Prolonged stress can lead to a range of physical health problems, including cardiovascular issues, weakened immune system, gastrointestinal disorders, and even chronic pain. It can also contribute to unhealthy behaviors like overeating, smoking, or excessive alcohol consumption. Mental health. Stress is closely linked to mental health disorders such as anxiety and depression. It can exacerbate symptoms and make recovery more challenging. Chronic stress can impair cognitive function, making it difficult to concentrate and make decisions. Emotional well-being. Stress can lead to mood swings, irritability, and feelings of helplessness. It can strain personal relationships and affect our ability to connect with others. Productivity and performance. High stress levels can lead to decreased productivity and lower job satisfaction. It can also hinder creativity and problem-solving abilities. Coping strategies for managing stress in daily life. There are various strategies to reduce and manage stress effectively. By incorporating these practices into your daily routine, you can take control of your stress levels and improve your overall well-being. 1. Identify stressors. The first step in managing stress is to identify the sources of your stress. Keep a stress journal to track what triggers your stress and when it occurs. Once you know your stressors, you can develop strategies to address them. 2. Practice mindfulness and meditation. Mindfulness and meditation techniques can help you stay in the present moment and reduce the impact of stressful thoughts and worries. Regular practice can enhance emotional regulation and reduce the physical symptoms of stress. 3. Exercise regularly. Physical activity is an excellent stress reducer. It releases endorphins, which are natural mood lifters. Whether it's yoga, jogging, or dancing, find an exercise you enjoy and make it a part of your routine. 4. Adequate sleep. Sleep is crucial for stress management. Aim for 7 to 9 hours of quality sleep each night. Create a relaxing bedtime routine and avoid electronic devices before sleep to improve your sleep quality. Mental health. Stress is closely linked to mental health disorders such as anxiety and depression. It can exacerbate symptoms and make recovery more challenging. Chronic stress can impair cognitive function, making it difficult to concentrate and make decisions. Emotional well-being. Stress can lead to mood swings, irritability, and feelings of helplessness. It can strain personal relationships and affect our ability to connect with others. Productivity and performance. High stress levels can lead to decreased productivity and lower job satisfaction. It can also hinder creativity and problem-solving abilities. Coping strategies for managing stress in daily life. There are various strategies to reduce and manage stress effectively. By incorporating these practices into your daily routine, you can take control of your stress levels and improve your overall well-being. 1. Identify stressors. The first step in managing stress is to identify the sources of your stress. Keep a stress journal to track what triggers your stress and when it occurs. Once you know your stressors, you can develop strategies to address them. 2. Practice mindfulness and meditation. Mindfulness and meditation techniques can help you stay in the present moment and reduce the impact of stressful thoughts and worries. Regular practice can enhance emotional regulation and reduce the physical symptoms of stress. 3. Exercise regularly. Physical activity is an excellent stress reducer. It releases endorphins, which are natural mood lifters. Whether it's yoga, jogging, or dancing, find an exercise you enjoy and make it a part of your routine. 4. Adequate sleep. Sleep is crucial for stress management. Aim for 7 to 9 hours of quality sleep each night. Create a relaxing bedtime routine and avoid electronic devices before sleep to improve your sleep quality. Relaxation techniques. Autogenic relaxation. Autogenic means something that comes from within you. In this relaxation activity, you use both visual imagery and body awareness to lower stress. You repeat words or suggestions in your mind that may help you relax and lessen muscle tension. For example, you may imagine a peaceful setting. Then you can focus on relaxing your breathing or slowing your heart rate. Or you may feel different physical senses, such as relaxing each arm or leg one by one. Progressive muscle relaxation. In progressive muscle relaxation, you focus on slowly tensing and then relaxing each muscle group. This can help you focus on the difference between muscle tension and relaxation. You can become more aware of physical sensations. In one type of progressive muscle relaxation, you start to tense and relax the muscles in your toes. You gradually work your way up to your neck and head. This is best done in a quiet area without interruptions. You also can start with your head and neck and work down to your toes. Tense your muscles for about 5 seconds and then relax for 30 seconds and repeat. Visualization. In visualization, you may form mental pictures to take a visual journey to a peaceful, calming place or situation. To relax using visualization, try to use as many senses as you can, such as smell, sight, sound, and touch. If you imagine relaxing at the ocean, think about the salt water's smell, the sound of crashing waves, and the feel of the warm sun on your body. You may want to close your eyes and sit in a quiet spot. Loosen any tight clothing and focus on your breathing. Aim to focus on the present and think positive thoughts. Other relaxation techniques may include deep breathing, massage, meditation, tai chi, yoga, music and art therapy. Now let's test your knowledge with a quick assessment. Answer the following questions to see how much you've learned. Fill in the blank spaces by picking the correct words. Deep breathing, exercise, progressive muscle, physical, challenging, stressors, visualization, meditation. 1. Stress is the body's natural response to situations. 2. Prolonged stress can lead to a range of health problems, including cardiovascular issues, weakened immune system, and chronic pain. 3. Mindfulness and our techniques can help reduce the impact of stressful thoughts and worries. 4. Is an excellent stress reducer as it releases endorphins, natural mood lifters. 5. Social support can provide emotional relief and different perspectives on. 6. Relaxation involves focusing on slowly tensing and then relaxing each muscle group to release tension. 7. Utilizes mental pictures to take a visual journey to a peaceful, calming place or situation. 8. Involves deep, slow breathing to reduce stress and promote relaxation. Let's review the correct answers to the assessment. 1. The correct answer is challenging. 2. The correct answer is physical. 3. The correct answer is mediation. 4. The correct answer is exercise. 5. The correct answer is stressors. 6. The correct answer is progressive muscle. 7. The correct answer is visualization. 8. The correct answer is deep breathing. We hope you got all the answers correct. Cultivating resilience. Definition and importance of resilience. Resilience means being able to handle tough times and bounce back from them. It's about being flexible in your thoughts, feelings, and actions when faced with challenges. It's important to know that being resilient is something you can learn and improve over time. It takes effort, support from others, and you might face setbacks along the way. Resilience depends on things like how you feel about yourself and how well you can communicate, as well as the support and resources available to you. Some of the key factors that contribute to personal resilience include the ways you view and engage with the world, the availability and quality of social resources, specific coping strategies, social support, your supportive social systems, which can include immediate or extended family, community, friends, and organizations. Foster your resilience in times of crisis or trauma. Self-esteem. Feeling good about yourself and believing in your abilities can prevent you from feeling powerless when things get tough. Emotional regulation, the capacity to manage potentially overwhelming emotions or seek assistance to work through them, helps people maintain focus when overcoming a challenge. Recognizing and leveraging personal strength. Learning about one's strengths and how to build on them is a very important factor in building resilience. In the next slide, there are some preliminary tips to get you started. Preliminary tips to recognize and leverage personal strengths. Define your strengths. The first step to leveraging your strengths is to identify what they are. Think about the things you are naturally good at and enjoy doing. These are your strengths. If you're not sure what your strengths are, ask a friend or family member for their input. Find a role that suits your strengths. Once you know what your strengths are, you can start looking for roles that suit them. For example, if you're a people person, you might want to consider a role in customer service or sales. If you're good at problem solving, you might want to consider a role in research or analysis. Use your strengths to your advantage. Once you've found a role that suits your strengths, it's time to start using them to your advantage. Leverage your strengths in everything you do, and look for opportunities to use your strengths as often as possible. The more you use your strengths, the better you will become at them and the more successful you will be. Don't be afraid to ask for help. Even when you're good at something, you still need help sometimes. It's okay to reach out and you won't succeed if you don't. When you find yourself struggling, look for someone who has more experience and ask them for help. Keep developing your strengths. Never stop expanding your strengths. The world is always changing and so are the skills that are in demand. By keeping your strengths current and expanding into new areas, you will have the skills to remain successful. Developing a positive mindset and outlook. Developing a positive mindset and outlook is crucial for building resilience, optimism, and a greater sense of well-being. Here are some tips on how to cultivate it. Gratitude practice. Try to focus on the thing you're grateful for, whether it's your support network, opportunities for growth, or small moments of joy. Reflecting on positive experiences can shift your perspective towards the positive aspects of your life. Cognitive reframing. When you're feeling upset or things aren't going well, try to think about them in a more positive way. Challenge those negative thoughts about yourself and replace them with kinder, more encouraging thoughts. Now let's test your knowledge with a quick assessment. Answer the following questions to see how much you've learned. Match each factor or concept with its corresponding description. Factors. 1. Ways you view and engage with the world. 2. Availability and quality of social resources. 3. Specific coping strategies. 4. Social support. 5. Self-esteem. 6. Emotional regulation. Descriptions. A. Your supportive social systems, including family, community, and friends, foster your resilience in times of crisis or trauma. B. Feeling good about yourself and believing in your abilities can prevent you from feeling powerless when facing challenges. C. The capacity to manage potentially overwhelming emotions helps maintain focus when overcoming challenges. D. Your perspective on life and how you interact with your environment can influence your ability to bounce back from tough times. E. The resources and networks available to you, such as friends, family, and community support, play a significant role in your resilience. F. Strategies and techniques you employ to cope with stressors and challenges in your life. Let's review the correct answers to the assessment. 1. The correct answer is D. 2. The correct answer is E. 3. The correct answer is F. 4. The correct answer is A. 5. The correct answer is B. 6. The correct answer is C. We hope you got all the answers correct. Self-care practices. The importance of self-care on well-being. Self-care means taking the time to do things that help you live well and improve both your physical health and mental health. This can help you manage stress, lower your risk of illness, and increase your energy. Even small acts of self-care in your daily life can have a big impact. If you don't practice self-care regularly, you're risking your well-being and inviting burnout. Self-care looks different for everyone, and it is important to find what you need and enjoy. It may take trial and error to discover what works best for you. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. According to this definition, self-care includes everything related to staying physically healthy, including hygiene, nutrition, and seeking medical care when needed. It's all the steps an individual can take to manage stressors in his or her life and take care of his or her own health and well-being. There are a few different categories of self-care. Emotional self-care, such as self-talk, weekly bubble baths, saying no to things that cause unnecessary stress, giving yourself permission to take a pause, or setting up a weekly coffee date with a friend. Physical self-care, such as prioritizing sleep, adopting an exercise routine you can stick with, or choosing healthy and nourishing foods over highly processed ones. Spiritual self-care, such as attending a religious service, spending time in nature, meditating, incorporating regular acts of kindness into your day, or keeping a gratitude journal. Self-care tips: get regular exercise. Just 30 minutes of walking every day can boost your mood and improve your health. Small amounts of exercise add up, so don't be discouraged if you can't do 30 minutes at one time. Eat healthy, regular meals and stay hydrated. A balanced diet and plenty of water can improve your energy and focus throughout the day. Pay attention to your intake of caffeine and alcohol and how they affect your mood and well-being. For some, decreasing caffeine and alcohol consumption can be helpful. Make sleep a priority, stick to a schedule, and make sure you're getting enough sleep. Blue light from devices and screens can make it harder to fall asleep, so reduce blue light exposure from your phone or computer before bedtime. Try a relaxing activity. Explore relaxation or wellness programs or apps, which may incorporate meditation, muscle relaxation, or breathing exercises. Schedule regular times for these and other healthy activities you enjoy, such as listening to music, reading, spending time in nature, and engaging in low-stress hobbies. Set goals and priorities. Decide what must get done now and what can wait. Learn to say no to new tasks if you start to feel like you're taking on too much. Try to appreciate what you have accomplished at the end of the day. Stay connected. Reach out to friends or family members who can provide emotional support and practical help. Developing a self-care routine. To get started with a self-care routine, determine which activities bring you joy, replenish your energy, and restore your balance. Start small by choosing one behavior you'd like to incorporate into your routine in the next week. Build up to practicing that behavior every day for 1 week. Reflect on how you feel. Add more practices when ready. Get support through sharing practices from loved ones, a coach, a licensed professional, like a therapist or dietitian, or through your healthcare plan, community, or workplace. Note: if you read this and feel a sense of demoralization or sadness from the challenges of mounting or establishing a self-care practice, it's best to get help and support. There may be barriers to caring for yourself from past trauma, mental health issues, or family situations that may be making it more challenging to get started. Seek support from trusted counselors and behavioral health providers, like a therapist, a trusted primary care doctor, or a close friend. The bottom line? Self-care can have a positive effect on your health and outlook, but it requires a commitment or intention to invest in your well-being. Fill in the blank spaces by picking the correct words: exercise, self-care, support, impact, self-care, balance, worker. 1. Means taking the time to do things that help you live well and improve both your physical health and mental health. 2. Even small acts of self-care in your daily life can have a big. 3. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health. 4. There are a few different categories of self-care, including emotional self-care, physical self-care, and spiritual. 5. Some self-care tips include getting regular, eating healthy, regular meals, making sleep a priority, trying a relaxing activity, setting goals and priorities, and staying connected. 6. To get started with a self-care routine, determine which activities bring you joy, replenish your energy, and restore your. 7. If you feel a sense of demoralization or sadness from the challenges of mounting or establishing a self-care practice, it's best to get help and. Let's review the correct answers to the assessment. 1. The correct answer is self-care. 2. The correct answer is impact. 3. The correct answer is worker. 4. The correct answer is self-care. 5. The correct answer is exercise. 6. The correct answer is balance. 7. The correct answer is support. We hope you got all the answers correct. Thank you for watching. The Health Me project is co-funded by the European Union. Views and opinions expressed are, however, those of the authors only, and do not necessarily reflect those of the European Union or the European Education and Culture Executive Agency. Neither the European Union nor the European Education and Culture Executive Agency can be held responsible for them.